Hello everyone, this is Roman Kriol-Schnitzer, and I'll be going through my technique for implanting a Hydrus while using ORA intraoperative aberrometry. The ORA is a great tool for improving our refractive outcomes, but it does make MIGS procedures sufficiently more difficult. It decreases the working space between the eyeball and the microscope, and I highly encourage all new MIGS users not to do it with an ORA. However, there are some ways to make this a little bit easier. Now, first, we're making our incision and preparing. I'd like to do my MIGS prior to cataract surgery, so I always mark my incision, give topical anesthesia, and fill the AC with cohesive viscoelastic. The first thing to do before my MIGS procedures is I make sure that the Hydrus microstent is prepared for insertion. What this means is I'll take the tip, as I'm about to show you, and I'm going to turn it so it's facing in the direction that I want it to be. There's that tip. Because remember, when we insert the Hydrus microstent, we want that tip, see that tracking wheel, we want that tip to be at about a 15 to 20 degree angle. And the last thing that I'm going to do when I know I have the ORA is I'm going to take off this blue back end. It doesn't actually serve any function when inserting the microstent, and it's going to give us more space, so it's not going to bump into the ORA. So here I am turning, then making sure that this is well aligned to the angle to how I'm actually going to want to insert it with that 15 to 20 degrees pointing more anteriorly. And then I'm going to take that blue back end off of the Hydrus microstent. It's on there pretty firmly, so sometimes you really have to grip it in both hands and pull quite significantly to get it off. But once you get it off, you'll notice that you have a lot more room to work with. That blue back end just pops off. It's a bit of plastic. It takes up about 1/3 of the Hydrus microstent. So once it's off, and you'll see the back side now, see how it's off, that back end is what typically hits that ORA when the eye is turned at a 45-degree angle. So now that we have the eye turned at our 45-degree angle, again, we can proceed with our normal insertion as we would with the Hydrus. So I always mark my incision so that way under gonioscopy I can see where I'm going in. This is a 25 gauge short needle. I do not like to use the injector when I put in my Hydrus microstent. So I like to first make a little groove, a little score with the 25 gauge needle right through the middle of the trabecular meshwork. And then I like to open up, fish mouth that opening. You'll be able to see a little white part behind the trabecular meshwork. See that white area? That is Schlemm's canal. You can even see a little bit of heme there, which is fantastic. Do not be afraid of heme in the trabecular meshwork. That is part of MIGS procedures. If there's a lot of it, you can always clear it by putting in some viscoelastic. But that heme is perfect because it shows you the landing spot. And again, my Hydrus is already prepped and ready. Once I have that heme, that opening, my assistant hands me the Hydrus microinjector. All I have to do is gently lay it against that back wall of Schlemm's canal, right where I had that opening, and it slides in smoothly. And then you insert the Hydrus microstent. Always, always, always make sure you check to make sure the placement is correct. You want to see all three windows in the trabecular meshwork, and you want to make sure that the stent is not diving. This should be very comfortable for the patient. If the patient is moving or if they're uncomfortable, then most likely the stent's in the wrong position. You should pull out and either replace it or put it inferiorly in a different location, or not place the stent at all, because you want to make sure that the stent at the end of the day is in the right position. There's a great view of our Hydrus microstent positioned correctly, and you can see all three windows with that snorkel sticking out. And here's a picture of the Hydrus microstent injector. It's that back red piece that I take off that takes up about 1/3 of the injector. That's going to increase your working space and makes this procedure significantly easier while using an ORA. That's how to do a Hydrus with an ORA intraoperative aberrometry. Thank you.